Good afternoon, Dr. Lewis. I appreciate you joining today's meeting. Our clinic has been approached by a company offering an artificial intelligence system that claims to detect dental diseases more accurately than conventional examinations. Before we make any decisions, I'd value your opinion.
Thank you, Dr. Carter. I've reviewed the proposal, and while the technology is certainly impressive, I think we should evaluate it critically rather than assuming it's a complete solution.
What concerns you the most?
Primarily, the tendency to overestimate what AI can actually do. These systems are exceptionally good at identifying patterns in radiographs, but diagnosing a patient involves much more than interpreting images. We have to consider medical history, lifestyle, symptoms, and even psychological factors that may influence oral health.
That's a fair point. The developers claim the software can identify early carious lesions, periodontal bone loss, and even signs of oral cancer with remarkable accuracy.
Those capabilities are undoubtedly valuable. Early detection could significantly improve treatment outcomes, particularly for conditions such as oral squamous cell carcinoma, where early intervention can be life-saving. Nevertheless, no algorithm can replace a comprehensive clinical examination.
I completely agree. Patients often expect immediate answers after a radiograph, but many diagnoses require combining several sources of information.
Exactly. Take periodontal disease, for example. A radiograph may reveal bone loss, but it doesn't measure bleeding on probing, pocket depth, tooth mobility, or the patient's oral hygiene habits. Those findings require clinical judgment.
Another issue is communication. Delivering a diagnosis isn't merely presenting facts. It's explaining complex information in a way patients can understand without causing unnecessary anxiety.
That's where empathy becomes indispensable. Imagine informing someone that a suspicious lesion requires a biopsy. The patient's emotional response is just as important as the clinical findings. Technology cannot reassure a frightened patient or answer their concerns with compassion.
Very true. I've also wondered whether relying too heavily on AI might affect the training of younger dentists. If they become dependent on automated diagnoses, they may not develop the critical thinking skills necessary to recognize unusual cases.
That's an excellent observation. Clinical experience is built through careful observation, questioning, and decision-making. AI should support education, not replace it.
On the other hand, I can certainly see its benefits. Reviewing hundreds of radiographs every week is mentally demanding, and even experienced clinicians can occasionally overlook subtle abnormalities.
Absolutely. AI could serve as a valuable second opinion, highlighting areas that deserve closer inspection. In that sense, it enhances patient safety rather than replacing professional expertise.
The proposal also mentions predictive analytics. Apparently, the software estimates a patient's future risk of developing caries or periodontal disease based on previous dental records, dietary habits, and oral hygiene practices.
That could transform preventive dentistry. Instead of simply treating disease after it appears, we could intervene much earlier by identifying high-risk patients and providing personalized preventive care.
Preventive treatment has always been more beneficial and less expensive than restorative procedures.
Precisely. Encouraging patients to improve their oral hygiene, reduce sugar consumption, and attend regular recall appointments is often far more effective than placing another restoration a few years later.
Of course, implementing this technology also raises ethical questions. Patient records contain highly sensitive information, and cybersecurity has become a growing concern in healthcare.
Confidentiality must remain our highest priority. Patients trust us with their personal information, and any technological innovation should strengthen, not compromise, that trust.
So, would you recommend adopting the system?
Yes, but with realistic expectations. We should view AI as an advanced diagnostic assistant rather than an autonomous decision maker. Final responsibility for diagnosis and treatment planning should always remain with the clinician.
I couldn't agree more. Dentistry has always combined science with human interaction. While technology continues to evolve, professional judgment, ethical responsibility, and compassionate patient care remain irreplaceable.
Exactly. The future of dentistry isn't about choosing between dentists and artificial intelligence. It's about combining the strengths of both to provide safer, earlier, and more personalized care.